My name is Jenny Weisner. I'm a certified athletic therapist and I work with Football Nova Scotia. I think my first real memory of sport was playing basketball when I was a kid. I just loved the environment. It was exciting being a part of that, working with teammates, being a team player. I always enjoyed it. So I always tried to stay busy, stay involved in whatever capacity that looked like. For me now, it's as an athletic therapist on the sideline. I love it. The competition spirit is always there and the athletes are incredible that you get to work with. I got a concussion when I was 7 years old, and it wasn't playing basketball, I was skating. And I was wearing a helmet, thankfully, but something happened, I lost my footing, I fell on the ice, and I landed right on the back of my head. Can't remember much beyond that, other than that initial injury and going home that night and how awful I felt. I often give the example of an ankle injury, and if you sprain your ankle, it's easy to know how to manage that because you can use pain as your guide. Right? So if it hurts to walk on your ankle, if it's sprained, you don't do that. But with concussion, if your brain is injured, it's not as easy to make that distinction. My rule of thumb is to, when in doubt, sit them out. If I'm not sure, then we'll just sit them on the sidelines so we have a chance to reassess. I hate the term bell rung. Hearing that on the sideline or hearing a coach say, player got their bell rung, it's not terminology that we use in football because it trivializes the injury. People often think that football is a risky sport and that, concussions are a huge injury risk or issue or concern. But the reality is there are far riskier sports that athletes can play and that we work really hard to make sure that our coaches recognize and our athletes recognize signs and symptoms of concussion. And it's really great to see other sports taking that seriously because that keeps all kids safe.
And so begins our program here tonight. It is Nova Scotia Concussion Awareness Day 2021. Good evening. My name is Bruce Rainnie. I'm the CEO of the Nova Scotia Sport Hall of Fame, a longtime broadcaster with CBC. A pleasure to be with you here tonight. An acknowledgement that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This is Dr. Tina Atkinson, the Chief Medical Officer at Sports Centre Atlantic. Interesting in that video, Jenny used the term bell rung. And if you're of a certain age like me, certainly, you can recall where at one point in time, this is very sad, but an athlete's toughness was measured by how fast they could come back after their bell was rung. If you go back on Google or YouTube and type in old games, you can see broadcasters of a generation perhaps older than me almost glorifying someone trying to get off the ice with wobbly legs. Thank goodness we've come a long way. I think that we're here tonight because we have a long way still to go. Welcome to you. I know you're a long-time advocate for concussion awareness here in Nova Scotia. Why is what we are doing tonight important?
Thanks, Bruce. I'm really happy to be here to promote concussion awareness in Nova Scotia on this very first annual Concussion Awareness Day. It is important for several reasons. The main one is we want to try to prevent concussions. We want to try to prevent a concussion on top of another concussion that hasn't fully healed. We also want people to know what to do so that they treat their concussion properly right away from the beginning, from the moment of injury. They know what to do, and that's your best chance of recovering fully and preventing any persistent symptoms.
We should mention that tonight we are focusing on concussions that are suffered in sport.
Yes.
We hope this is an annual event and that other concussions will be explored in years ahead. Much of what we're doing tonight stems from something called Rowan's Law. If you haven't heard of it in a while, can you refresh us a bit?
Yeah, so Rowan's Law is actually a law that was passed legislation in Ontario, and Rowan's Law Day is today in Ontario. And came about because of a young rugby player in Ontario named Rowan Stringer, who was the captain of her high school rugby team and unfortunately died of second impact syndrome, which is she had a catastrophic injury to her brain after already suffering concussions in the previous week. They had an inquiry into her death, and they realized and they found out that she had symptoms but didn't realize it was a concussion, didn't know that she needed time to heal, kept playing, and then unfortunately had the catastrophic injury. Her parents, coaches, officials, no one really realized that she had suffered these prior head injuries and concussions, and so she kept playing. So the Concussion Awareness Day across the country and Concussion Awareness Week is really inspired by Rowan's story, and really important that we bring more awareness and education to concussion for everyone to be aware.
We're going to see a lot of vignettes from here in Nova Scotia tonight. A reminder, we're also going to take some questions from you. We're available tonight on Zoom chat and Facebook live chat as well, so get those in. The last 15 minutes of this program from about 7:45 to 8 o'clock will be dedicated to answering questions from you. For now, though, here's another vignette.
My name is Tim Harmon from Fall River, Nova Scotia, and I coach rugby here in Nova Scotia. The sport kind of grabbed me as it does, and I ran with it as best I could, as far as I could. I was playing for Brock University. We were up in Kingston playing Queens. So I was playing fullback that game. Just got my head caught on the wrong side of the tackle. Took a hip to the side of the head and then hip between ground smush. Took myself out at half and said, hey, I know what's going on right now and it's no good for me. I'm taking myself out of this. And that was the last time I strapped up boots for a rugby game. It was certainly challenging. I was dealing with a lot of depression, a lot of anxiety, and this went on for 4, 5, 6 months of really, really bad depression, again, related to not being able to do what I love, trying to redefine who I was. For so many years, I was not only just Tim the rugby player, but Tim the athlete, and at this point, I wasn't even able to go to the gym without getting a headache. I'm consider myself, even as bad as it was, one of the lucky ones. Post-concussion syndrome can last years, and symptoms of what happens during concussions can last a lifetime. At the end of the day, these are amateur athletes doing this for fun. I took myself out of my last rugby game because I knew where it led, and I'd had enough of them to know that I was in trouble, and more education and more awareness to athletes to put that responsibility on them and know what that responsibility, the weight of that responsibility, is very important. So I make sure all my athletes know where I come from as a coach. Going into every game, they understand that. And I expect them to be very honest and forthcoming when they do have a knock to the head. If we think there's a chance, you're not going back in. We've seen lives lost in this game for people going back into the game, either in the same game or going back to the game too early. That's a risk that's known now, is that you could die if not taken seriously.
And we continue with Nova Scotia Concussion Awareness Day 2021, a reintroduction of Dr. Tina Atkinson, the Chief Medical Officer at Canada Sports Centre Atlantic. Also on our panel here tonight is Dr. Mark Maclaine. Mark is a neurosurgery resident at Dalhousie University. Natalie Thornley is an occupational therapist with acquired brain injury services at Nova Scotia Health. Welcome to all. And Natalie, let's early on tonight define our terms. Simply, what is a concussion?
Sure. Well, a concussion is a brain injury, and it's caused by a hit or a jolt to the head, the neck, or the body. And what happens is the brain shifts back and forth inside the skull, which causes injury. And most people don't experience a loss of consciousness with a concussion, but most people feel dazed at the time of the injury. The signs and the symptoms of concussion may occur right away at time of the injury, but for others, the symptoms will evolve over the course of several hours after the injury.
Dr. Maclaine, Mark, what are those signs and symptoms?
Sure, thanks for the question, Bruce, and for having us this evening for this great cause. So you probably heard the term signs and symptoms of concussion, so let's just quickly define those. A sign is a visual clue. So athletes, coaches, and parents might observe certain signs in someone who has a potential concussion. So it's what you're observing in someone. A symptom, on the other hand, a symptom is what people are experiencing. It's what they're telling you that they feel. So some examples of a sign would include slurred speech, potentially being off balance or lacking coordination, or potentially even also being confused or disoriented to person, place, time, maybe even the score of the game. With regards to symptoms, now this is not exhaustive by any means, there's a long list, but this could include nausea, having ringing in the ears or blurred vision, and the one we're all familiar with, of course, headache. So on that note, I would like to just take a second to mention that there are some red flags that would prompt seeking urgent medical attention. And these would be potentially signs that there could be a more underlying or severe injury. So some red flags might include having neck pain or tenderness, or potentially weakness in the arms or the legs, or even loss of consciousness. So if those are present, certainly you want to seek urgent medical attention. There's a lot of information, so just to wrap it up, I would like to say that all concussions are unique, and certainly there's no defined set of symptoms and signs. Each concussion is unique, so it's important to keep that in mind.
Yeah, one thing we're going to explore in great detail tonight is what to do if you think you have a concussion. We'll take a hard look at that answer and that question next. First, though, another vignette.
I grew up playing in Cole Harbour, Nova Scotia, for the Cole Harbour Wings. And I played my whole life up until right through to Major Midget. I was about 16 or 17 every year in Cole Harbour all the way through. A lot of successful years, a lot of good friends I still have to this day, and a lot of great memories from our times. You know, we grew up in the Don Cherry's Rock'em Sock'em era too, of watching those videos where it was almost a comedy scene. You see a guy get checked and then get up and have the wobbly legs and need help skating to the bench, and we almost made a hero to the guy that did it and made a comedy show to the guy that couldn't get to the bench. And I certainly couldn't tell you I knew what a concussion was at that time, and truthfully, I don't know. I don't know if my parents did, you know. It certainly wasn't something we were educated and aware of in those times. That's the way it was. And unfortunately, looking back, it's scary, but that's really that's how I grew up in hockey. We now know as coaches, we're directed and we're aware that somebody comes off and says their head hurts or they have a headache and they took a direct blow to the head. You know, let's sit down, let somebody on the medical side, the athletic therapist or a team doctor come see you and assess you before you go back on the ice. My son is 7 years old and plays hockey, and he's more aware of what a concussion is than I was when I was 19. I mean, that sounds foolish to say, but I mean, the things we used to chuckle about in Rock'em Sock'em, he looks at that in a completely different way than I did when I was his age, and that's a good thing. It's a fine line. You don't want to put a fear into the children, but I think we certainly have to let them know that when you bump your head, it's different than bumping the rest of your body. You bump your head on the ice, be as honest as possible with the people around you on the ice, with the coaches, and if your head is bothering you or something doesn't feel right, you need to speak up and say something right away, because as we know, it is different than injuries in other parts of your body. It could have long-lasting implications, and if something doesn't feel right, speak up right away and let an adult around you know.
All right, a thank you to John. I want to mention tonight that this program, this Nova Scotia Concussion Awareness Program, is being brought to you by several sponsors. They include the Province of Nova Scotia, the Brain Injury Association of Nova Scotia, the Nova Scotia Sport Hall of Fame, Canadian Sports Centre Atlantic, and Sport Nova Scotia. We thank you to all of those listed at the bottom of the screen for making this possible tonight. We promised before this last vignette that we talk about what to do if you think you have a concussion. What's your best advice here tonight?
So the main thing is you need to speak up. If you feel like you have any of the symptoms that we just went over, or if you're an observer, a parent, a coach, an official, and you see someone with those signs where they're off balance or they're acting funny, and sometimes it's just they're very emotional, sometimes it's that their personality has changed a little bit, then you should suspect a concussion. And if you suspect a concussion, we want you to remove yourself or remove someone else from that activity. So you should never go back to your sport in the same day that you think you suffered any symptoms of concussion. And sometimes we don't know if it's a concussion or not, but if it's suspected, it's really important that you take yourself out. Or if you're a parent, coach, or official, you take that player out of that game.
So Natalie, once someone is diagnosed with a concussion, I guess recovery begins almost right away. What's involved there?
Well, in the first 48 hours following concussion, both physical and cognitive rest are really important. So this does mean things like sleeping as much as you need to, no screen times, and no physical activity. But beyond that 48 hours, it's really important to start to gradually return to activity. And you will need to take it slow. The goal here is to find that sweet spot between doing too much and too little. And what we now know is that doing nothing won't help with your recovery. But going back to activity too soon can worsen your symptoms and slow your recovery. So we have some concussion protocols that help with the step-by-step progression of activity to help you with return to play. And these protocols start with light activity. So that's things like it may be doing some chores around the house, or it may be homework at home, and a gradual, really gentle reintroduction to physical activity. And these concussion protocols are 6-stage processes. And you should stay in each step, or we advise you stay in each step for at least 24 hours. You move on to the next stage once you're able to tolerate your current activities without a worsening of symptoms. But if your symptoms do worsen, just stop, go back to the previous stage and stay there for at least 24 hours until you're feeling better. And over time, what we would expect with this slow, gradual, and intentional return to activity is that your symptoms are going to start to subside, and you'll gradually be able to return to the things that you want to and you need to be doing.
So when you hear the question then, what do I do if I'm not getting better? It's just slow down and go back to the previous step?
Yeah, it's really taking a look at what you're doing, how you're doing it, how long, what's the environment that you're trying to do it in, and take it back a little bit. We recommend thinking about your day in small doses, like 30 minutes of activity. Then stop and evaluate how you're doing, how you're feeling. You'll likely need to change your activity, change the demands on your brain and your body for a short period of time. You may need to go from a thinking task. So if you've been on the screens for a while and you've been concentrating and thinking, you may not need to lie down and rest, but you probably should shift to a completely different activity, like maybe a gentle walk, something physical that doesn't have the same demands. And over time, we'll see you gradually increase your tolerance for activity and get back to doing the things you need to do.
So Mark, that's the road to recovery, but it can be such a traumatic thing, I would think, especially for a kid. Does a concussion mean that your career is compromised or over?
Well, on a positive note, about 80 to 90% of concussions are treatable, and within about 3 to 4 week period of time, those 80 to 90% of individuals will go on to a near complete recovery. So I think that's a positive thing. But just a personal anecdote. I grew up playing hockey in Halifax for the Halifax Hawks, and I remember the competitive nature of playing in sport. It certainly makes it difficult to speak up. And there's a fear of missing out. There's a fear of losing your spot on a team. So on that note, I think that we need to change the attitude and behavior and beliefs around concussion. Make it okay to speak up. Make it okay to remove yourself from play without fear of losing your spot, because that's really what's going to offer you the best chance at continuing on in the sport in a healthy fashion. And certainly it's going to prevent those career-ending return to play too early and having another concussion that sets you out.
I want to ask you about the other concussion, the multiple concussion. How many of these can you have before your career is in danger?
Yeah, it's a good question. I think probably the best way to answer that is with an analogy. So imagine if you were walking down the street or you're playing a sport and you fall down and you hit your knee. You injure your knee, you can look down at it, you can see the bruise or the injury, and it's obvious to you. You want to try to avoid hitting it again because it's going to be painful. It's going to cause worsening of your symptoms. You can see that. The brain is no exception. The big difference is that we can't see our brain. Just because the injury isn't visible to your eye doesn't mean that it's not there. So your brain needs to recover just like any other part of your body. With regards to your question, does another hit worsen things? What we do know from the scientific literature is that if you have another injury too early, it could potentially prolong your symptoms and maybe worsen them. It's not as clear whether it increases the severity of the next injury, but it will prolong them.
Okay, this is Nova Scotia Concussion Awareness Day 2021. The focus this year on sports, and we hope this becomes an annual event where the focuses change as the years go along. A reminder, you can get questions to us on Zoom chat or Facebook live chat. We'll address those with about 15 minutes to go left in the program here tonight. For now, though, here's another vignette.
My name is Veronica Curry. I'm a female lacrosse coach and player. I was about 14 when I had my first concussion, and I was lucky enough that my dad was one of the coaches on the bench, so he could tell right away that something was wrong. And I was sitting down, I was shaking, I was kind of scared, and not really knowing what's going on. And he came over to me and he started asking me questions, like, where are we? What game are we playing? And I knew all the answers fine, but there was still something off. I remember sitting in class and I was holding my head like this, with my elbows on my desk, holding my head. And my teacher actually came up to me and said, "Veronica, are you okay?" And I was like, "Oh, I just have a really bad headache." And my parents had told her I missed the week of school because of my concussion, and she said, "You need to go to the office and call home." I was a little bit embarrassed because I felt like it was embarrassing to fall and get hit, and it was embarrassing to sit on the sidelines. I wanted to be in the play. And to see all your friends and teammates out on the floor having fun, participating in practice, learning new plays while you can't participate is pretty tough. As a player growing up, I've seen lots of my teammates hide concussions, hide injuries from coaches because they want to play, they want to be on the floor. So it's super important to me to create that bond with my players so that they know that they can come to me, and I don't want any injuries on my bench that I don't know about. I would like to have a conversation with a player's parents, tell them what happened, say they might need to go see a doctor based on the severity of the injury, and they probably shouldn't be left alone for a little while. But it's something to take seriously, and it's something that bleeds into every other aspect of your life. You'll have to miss out on family events, hanging out with your friends, but you'll be glad that you took a month to recover instead of 3 months or a year in the long run.
Sports.
So there definitely is a coach who gets it. Dr. Atkinson, you and I were talking before the show. I happen to be reading a book right now on the 1970s Pittsburgh Steelers, a long time ago. They had a center, an all-pro by the name of Mike Webster, who was the best ever at where he played and what he did. But his end of life was awful because of concussions he suffered. And in the book, it indicates that not only did he want to stay in the game to not lose his spot, but the coaches wanted him to stay in the game so that the Steelers would win. That culture is shifting, is it not, among coaches?
Yes, definitely. I think it's driven from a lot of different factors, but the coaches have definitely improved. I think we have a long way to go. They've improved their awareness. They've improved sort of the culture that they create on their team to allow people to speak up and allow people to get through the concussion protocol without pressuring them to get back, to the team or back in play. So that is changing. I think the athletes themselves are demanding change, and the sports governing bodies are realizing that they need to change and make it more. We need to normalize speaking up and telling someone that you have your symptoms, go in the concussion protocol, recover fully, and then come back.
What's your advice to a coach who sees a kid or a player in some sort of trouble that might be concussion related?
Right. I mean, a couple of the vignettes have already addressed this, which is I'm really glad to see. I think they just need to have, if they look at a player and they consider something's wrong there, maybe they have a concussion, then act on it and take them out of the game.
Dr. Maclaine, there is something called the 4 R's. It's nice when we can simplify things into acronyms, the 4 R's. Talk us through those and we'll build towards the fourth one in particular.
Certainly. So we've covered a lot of valuable information so far, and it's we've got basically the 4 R's, nice way to try and tie things together. So many sports teams do have, or sports associations do have protocols for approach to concussion, and certainly if those are available, those are very valuable resources to use. The Sport Information Resource Centre of Canada, CIRC, partnered with the Canadian government to come up with a relatively straightforward way to approach protocols, and so this is summarized by 4 R's. The first is recognition. So as mentioned, there are certain signs and symptoms of concussion which are important to be aware of, and sometimes it can be difficult, especially in the heat of the moment, if a loved one or a teammate has experienced concussion, to try and remember these off the top of your head. So there are tools like the Concussion Resource Tool, Concussion Recognition Tool 5, which is CRT5, very valuable resource which can help with recognition and freely available online. You can print it, download it off of the internet, and could even have it on the sidelines. It's just a single page. So that aid can help with recognition. The second R is removal from play. So when a player or an athlete or any individual that's experienced a brain injury and is having signs and symptoms, the most important thing is that they would be removed from play. And the third R is referral to a licensed medical professional. Certainly with respect to the red flags, we talked about the need for urgent medical assessment. But for concussions where there's no red flags present, individuals may choose to look into sports medicine or concussion clinics that have a balanced approach to concussion management. And on that note, I would say that it's beneficial not just to see a medical doctor or nurse practitioner, but also other allied healthcare professionals, such as occupational therapists or psychologists that are often part of these clinics. So then the fourth R is return to play. So I think we've already touched on that a little bit, but certainly there's the 6-step approach to returning to play. And so just to summarize, those 4 R's are recognition, remove from play, and referral to a medical professional, and try to keep them all straight. They're pretty simple, hey?
Yeah.
And then the fourth is return to play.
I always get stuck on the third letter every time I do this stuff. So anyway, thank you for that. We're going to dig deep into return to play in just a moment. First, though, another vignette.
I am Jessicawinkles, and I am a longtime equestrian. I have been riding for 25 years, and I am now an instructor, and I have a few students of my own that I've been teaching. My horse Nico, he got his foot stuck and he fell on the train track, and my body just kind of still laid lifeless on the train tracks. I don't remember really any of it, and when he fell over, he got up. He was really panicked, so he got up and he ran back to the stable. But then it was so lucky because my father was actually watching when that happened, so he was able to do something immediately about that. Someone who's just starting riding, they'll ask me, a kid, they'll ask me, can I get hurt doing this? And the answer is yes, you can. You can get hurt doing this. But that's why we are safe about things and we wear a helmet. I was wearing a helmet, thankfully, which is good because I really think that I'd be dead if I wasn't. I've never ridden a horse without one. Luckily, that was kind of taught to me as I learned to ride, that's the first thing you do is put a helmet on before you get on your horse. The big thing that I guess that really sticks out to me with concussion that I've learned is that it's so connected with mental health.
All right, we thank Natalie for that. I want to bring in Natalie down at the end of our panel here as well to talk about return to play. It's something we touched on a bit earlier in the program, but we want to delve a bit deeper now into it. It's a tough one, right? You have to be very careful with this, make sure it's timed right and correctly and safely. What can you say about return to play for an athlete who has suffered a concussion?
Well, I think what we now know is that the more you know about what to expect as part of the recovery, the better your recovery will be and the quicker it will be. And returning to play isn't standing in isolation. When we look at return to play, we also have to, for many of these athletes, we need to look at returning to learning, and we need to look at returning to work for some of our older athletes. And these things have to happen together. And we're now knowing that in many circumstances, we need to be able to get people back to their everyday routines, their everyday activities. They need to be able to do their regular routines, getting up, managing their days, getting to school, managing their schoolwork. It's before they get back to full play. So we spend a lot of time working with people, helping them understand what is concussion, what to expect, how to recognize the signs and the symptoms as it relates to them in their situation. So where are the signs and symptoms showing up for them? What do they look like every day? How do they know when they've done too much? So we spend a lot of time with people trying to learn, how do I know? When do I detect? How do I know I've done too much? And we look at things like pacing your activities. How do you plan? How do you prioritize? We all have things we want to and we need to do, so we just can't stop and wait for concussion to go away. So the things we're doing with athletes, with learners, with workers, with parents, is we're helping them figure out how to live with concussion now, how to improve and resolve the symptoms that they're experiencing, and how to get back to the activities that they need to be doing. And when you're talking about sport, specifically, we need you to work together with your coaches, with your parents, and with your medical team in many cases. If you're looking to return to contact sports, you absolutely need to get a physician involved in your care for clearance to return to contact. So returning to activity, returning to play isn't something we expect you to do on your own. And that's why we're really pleased that there are resources and tools out there that are specifically written and designed for the athlete, for the parent, for the coaches. We now even have tools that are designed for the teachers to help them support the person in their recovery. Because we know that, you know, some of these people are not just returning to a single sport. You may do basketball on Monday night, and then you're doing soccer on Wednesday night, and then you're going to school. So we need to make sure that all the people that are involved in that athlete and that person's care and their life knows what they're going through and how to adjust their routine, their days, their activities to be a good match for where they're at in their recovery and promote their healing.
How many concussions are we seeing a year in Nova Scotia?
In Canada, we're seeing 200,000 a year, and about 50% of those are related to sport.
And perhaps more that aren't even being reported?
I think we all believe there's many that aren't being reported, yes.
Yeah. I think the big goal here tonight, and we've spoken about this, is to get more people to report them. How do you do that?
I think this is a good first step. People need to know that what they're experiencing could be a concussion, and just tell someone. You know, tell their parent, tell their coach, tell an official if it's in the middle of a game. I've covered rugby games, for instance, and lots of other sports where an athlete did actually go to an official and or just kind of stayed down and until somebody came over and said, you know, maybe something's wrong and we're going to take you out of the game. So we just have to create a culture where this is normal. I think we see information about concussion on TSN and things like that quite often, you know, so the younger kids actually know quite a bit about concussion, as John Greenwood said in his vignette. But we still are, there is an age group that is lacking that information and maybe don't take it as seriously. And we just need people to know that if you suspect you might have a concussion, speak up.
Natalie, what's your best advice for parents who are guiding their kids through concussion recovery? Because I assume it's very tough on parents as well to watch their young person struggle.
Yeah, great question. My best advice is to get informed. You know what's going on in concussion, know what's going on in sport and what to expect. And like we said, fortunately, there's many sporting organizations that are getting on board with this, and they're setting parents up to be better equipped to know about concussion, to recognize signs and symptoms early, and how to work together with their child, as well as with the schools and the athletes and coaches. So I would say, check out our resources that will be linked. There are some great tools there for parents to support them in supporting their child and returning to play, and not just returning to play, but recovering quickly and safely from a concussion.
We're going to have those resources listed at the end of this program here tonight. A reminder, if you'd like to submit a question to this esteemed panel, you can do so on Zoom chat or Facebook live chat. We'll get to those questions in just a moment. First, though, time for one more vignette.
Hi, my name is Lee Denny. I'm from Cape Breton in the Mi'kmaq community called Eskizoni. As long as I can remember, I've been on the ice. Our community is kind of competitive in hockey, so everybody wants to play hockey, everyone wants to win. I love everything about it. I consider myself a playmaker, so I like making plays, I like to compete. I started pretty young, and my dad always put a stick in my hand, and he put rollerblades on my feet. Started out playing roller hockey in the house, and eventually ended up on the ice. So I understood what concussions were when I was older, but I never understood it until I got to junior hockey, and the doctor told me I was diagnosed with a concussion. That's when I kind of took it serious at that age. My last one, when I played junior A, that one was kind of serious. I knew I needed to take a break from hockey to focus on my health. It wasn't until I played the next year in junior B, and that's when I got my major concussion. I collided with a player, hit me in the head, and I just collapsed on the ice, and I crawled off the ice after that. After I got hit, I went to see a doctor at a local hospital, and I had to stay overnight because I was puking and having headaches, and I keep blacking out, so they told me to stay overnight. The next morning, I spoke with 2 different doctors, and they told me I shouldn't play hockey anymore. If I can go back, I would definitely tell my parents that I've been hit to the head. I did see stars. I do have a headache, and I probably should get checked out.
All right, we thank Lee for his honesty there. Once again, back here with Dr. Tina Atkinson, Dr. Mark Maclaine, and Natalie Thornley discussing Nova Scotia Concussion Awareness Week 2021. As promised, we've received a lot of questions from you. Thank you for these, and we'll ask our panel to take these and get through as many as we can in the time that remains here on the program. Dr. Maclaine, this one I think for you. Does a harder hit mean a more severe concussion?
So as was mentioned a little bit earlier on, a concussion is a brain injury, and it results in from the brain moving around within the skull. And this results in acceleration of the brain, either in the forward, backward, or side-to-side direction. The velocity of an impact can certainly, if the velocity is higher, it could certainly increase the chance that the brain is going to make a more significant contact with whatever it's bumping into. It can be direct or indirect. So the short answer is potentially. Things that you can potentially do to help mitigate that risk would be well, it's multifactorial, but one of the things that could be done is actually to help strengthen the neck muscles. It's been shown that improved strength of the neck muscles through simple exercises, side-to-side bending, forward and backwards, or shrugging, can help build the muscles that stabilize the neck and decrease the velocity of the impact and potentially reduce the significance of a concussion.
Do mouth guards help as well?
Don't know that there is robust scientific data to support that, but certainly if you have access to a mouth guard, that's for one, first and foremost. Not everybody has access to a mouth guard, but if you do, then it would be potentially helpful. So there's little harm to doing that.
Dr. Atkinson, can you take pain medication after a concussion?
We advise not to in that first 48 hours, just because it can interfere with healing, or it can make someone feel a lot better than they were feeling, and then they might be tempted to go back in and play again and risk hitting their head again. After the 48 hours, or if you have someone with you that is, like if it's a child and a parent is there and they have a headache that they want to give them Tylenol, that would be fine. For a concussion headache, though, actually, usually Tylenol and ibuprofen, which are the normal headache remedies, don't actually work.
Based on your answer to that, I can guess your answer to this. Can you use alcohol or cannabis after a concussion?
That is not advised for a couple of reasons. First of all, it can interfere with your recovery. Most people feel quite unwell. That's what I hear in my clinic. They think it might help them sleep or help them be a little less anxious, but actually once they try it, they really don't feel well. So I don't advise taking any other brain-altering medications while you're recovering from a concussion.
Natalie, one I think that you can handle here quite nicely. What do I do about school if I'm having problems, and should I write exams?
Yeah, again, there's no one answer. So what to do about school is start partnering. So talk to if you have a parent to speak to about, start conversations with your parents. Link with your school. The school is there to support you in your recovery. They can make adaptations, modifications to your return to school. You would start by possibly doing work at home, gradually returning to the school place. There are step-by-step progressions in these protocols that are available for return to learn. What's really nice these days is there's a return to learn protocol that helps practitioners, parents, students lay out exactly what they're experiencing, and it lists possible accommodations to adapt and adjust to that person. And that can be a tool that you can use together with your school, with your parent, with yourself to adjust your approach to returning to learning. But the principles are the same. Go slow. Do things in short bouts of activity. Switch your activity regularly. That's the general message about returning to activity, and it certainly applies to school.
Dr. Maclaine, I think you've kind of touched on this tonight, but here's a real specific directed question. Is a concussion always obvious right away?
It's a great question. As mentioned earlier on, all concussions are unique. Many different signs and symptoms that can be associated with them. Many are familiar with some of the videos from back in the day, the Don Cherry's Rock'em Sock'em videos, the hockey videos. You remember seeing players like Eric Lindros get hit significantly, be wobbling afterwards, trying to get up, having the so-called Bambi legs. Those characteristic signs of significant concussion are not present all the time by any means. And in many cases, the signs aren't obvious at first, and they can come on in a delayed fashion. So it's one of the reasons why it's important to be brushed up on what the different signs and symptoms are. Certainly there's not a one-fits-all.
Yeah, important for coaches to be brushed up. And here's a great question for Dr. Tina. What makes a coach concussion friendly? And kind of part B, how can coaches make sure they are?
So many of the sports, especially the contact collision sports, have mandatory education for coaches now, which is excellent. And so that's helping to change the culture. And I think that a lot of coaches have a personal experience with concussion, either themselves or a family member or a player, and so they learn from that. And they just help to create a culture where you feel safe in speaking up and telling them and knowing that they're going to take care of you and listen to you and not kind of pressure you to get back in the game, which we know used to happen. So it's really about creating a safe culture, normalizing the language around concussion, encouraging people to speak up, as a couple of the coaches talked about in the vignettes, as well as knowing what a concussion protocol is and how long it's going to take, supporting that athlete in their return to play.
A personal story here from Andy on Zoom. He says, I was forced to retire 8 years ago as a high-level baseball umpire after my third concussion from repeated foul balls to my mask. Since then, I've had 3 or 4 migraines per year. Is this a common occurrence in a long-term post-concussion recovery? And will it get better the more time that passes? Do you want to take a run at that one?
Sure. So post-concussion headaches are very common. There's specific diagnosis around whether that's a migraine or not, and I'm not sure what the particular circumstance is in his case. We know that people that have migraines preceding a concussion are more likely to have more migraines or headaches afterwards. So that is something that we know. It is a possible red flag, we call it, for having persistent symptoms and taking a little bit longer to get better after a concussion to fully recover if you have migraines. In certain cases, a concussion could trigger new types of headaches, possibly migraine. They're not always migraines, but the treatment for migraine is learning to manage your triggers and learning how to avoid those and live a healthy lifestyle to try to avoid migraines. So time can help, but also learning how to deal with the migraines.
Could I stick with you, because I know we spoke about this in the green room prior to our program here, but the question is, do I need to wake up my child every hour when they are sleeping? That used to be,
yes.
I don't know if it was recommended, but people did it, didn't they?
Oh yeah, that was routine, and when I was in med school, that's what we learned, and I worked in emergency for the first 9 years of my career, and that's what we told people. But now the thinking is different. We want that child to get good sleep that first night after the concussion, or first night or two. Now, we know parents are going to be nervous, and so I tell them, go in and check on the child, make sure they're okay, make sure they're breathing, make sure they're okay, but you don't need to wake them up fully.
Dr. Maclaine, do you need to get a CT scan after a concussion?
Yeah, another great question, Bruce. So the short answer is that for most concussions, no brain imaging is required, thankfully. We discussed the red flags earlier that might prompt urgent medical assessment. And in certain cases, once assessed by a licensed healthcare professional, there may be a decision to either pursue a CAT scan or an alternative form of brain imaging called an MRI scan. But those would be the minority of cases, thankfully.
Okay. Natalie, my doctor told my child to have mental rest. What exactly does rest mean? And can my child watch television, play video games, text, etc.? Again, you've touched on that earlier, but to regroup here a bit.
So for the first 48 hours, no. No screens, no iPads, no video games, no phones. That's the first 48 hours. But then, as we said, it's really important to gradually reintroduce. So we want to achieve that balance of activities. You want to make sure you're not doing any one thing for a long period of time. Returning to these things is important. They need to be part of the plan. You're going to increase light cognitive activity, light physical activity, increase your time on the computer screens, all that. You're going to do it in a step-by-step progression, though. You do these activities, If they don't exacerbate or worsen your symptoms, then you can look at progressing. And you stick with one plan for 24 hours. If that's going okay, move up. But if it's not, then step back and stick with what was working, that was not worsening your symptoms.
Okay. Dr. Atkinson, can you discuss the difference between concussion and traumatic brain injury?
So concussion, this is sort of new in the most recent literature. Concussion is considered a mild traumatic brain injury, and a mild traumatic brain injury is a subset of traumatic brain injury. So concussion refers to the initial event, the actual movement of the brain inside the skull. And then mild traumatic brain injury, some people believe concussion is a subset of that. Most of the literature uses mild traumatic brain injury, or MTBI, and concussion interchangeably.
What should I do if I don't have a family doctor? And the follow-up question is, what if I can't get an appointment with the doctor for several weeks?
Yeah, so that's part of the reason why it's so important what we're doing here tonight, to give people the awareness that they know that they might have a concussion, they know what to do, which is take themselves out of that risky activity, and then they know the first steps to do in the first few days, as Natalie's gone over. As well, they know that they're going to need to follow some kind of return to activity plan. We know it's difficult in Nova Scotia to see a family doctor right away, so we want to give them the tools to be able to manage things on their own for a certain amount of time until they can get in to see their nurse practitioner or family doc.
Dr. Maclaine, it seems obvious, but I'd love to hear your answer anyway. Does a helmet help prevent concussion?
Along the lines of a mouth guard, I guess it depends on what sport you're participating in. Having more protection certainly isn't going to be harmful. So in the case of, whether it's something as simple as, cycling, well, don't say cycling is simple because it certainly can be challenging, but in the case where you're maybe not actually playing in a contact sport, we know that, wearing a helmet is a form of a risk reduction and potentially and hurting yourself, right? So, and that's certainly the case in contact sports. So I'm an advocate of helmets personally.
Yeah. Dr. Atkinson, can depression be a persistent symptom of a concussion?
Yes, so the persistent symptoms we haven't touched on a lot this evening, but that's about 10 to 20% of all concussions may develop persistent symptoms, which means they persist for longer than 4 weeks. And mental health issues, depression, anxiety is certainly one of the larger categories of persistent symptoms that we see. There are several reasons for that. It can be triggered directly from the concussion. It can be affected by poor sleep, which many people have after concussion. Also, loss of their lifestyle, loss of their sense of self, loss of their sport and the social network that go along with that. So it's very important to address that right away. And like Natalie said earlier, let people know that that could happen, and if it happens to you, it is pretty common, and we need to be aware of it and start treating it right away.
So if there are persistent symptoms after that 4-month mark or whatever, what do you do? How do you handle it?
So we do know that the persistent symptoms fall in certain categories, and we see that as a pattern. Every concussion is unique, so not everyone's going to have every symptom or every category. But we do know that those symptoms are treatable. So at that point, it's advisable to seek interdisciplinary care, which means some of the allied health providers that we talked about earlier today, physio, chiropractor, occupational therapy, massage, all of those, psychology, all of them have a role to play depending on what your symptoms are. And there are several really good interdisciplinary and allied health clinics in Nova Scotia that manage a fair amount of concussions.
Natalie, a question here. What should I expect if I come to see someone like you after suffering a concussion?
Well, we start with a good dose of education. So, and our first, we want you to make sure that you understand what you've experienced, what your symptoms are, and I think there's a lot of validation of, we understand what you're going through. We're going to take you through what we would expect for concussion recovery, how those signs and symptoms would be showing up in your life. And then we're going to start working with you on strategies and approaches to help you manage. So we're about symptom management in order to help you better be able to engage in what you need to do. We're trying to build your tolerance back to get back to doing what you need to do. So we're going to look at all of your roles, all of your routines, and we're going to work with you on how the symptoms are affecting those. So it's a lot of self-directed care. You know, we want to equip you to be able to change your approach to tasks to better manage your symptoms and get you back to doing your things.
Dr. Maclaine, I want to finish with a question that my son asked me a couple of days back. I was showing him pictures of Eric Lindros, and he was a favorite hockey player of mine. He was about 6'5" and played at about 240 to 245 pounds, built like Hulk Hogan in his day, just huge, big neck muscles, big shoulders, huge arms. How did he ever suffer concussions? How does that happen to someone of that size and that physical dominance?
The brain is a delicate organ, and it doesn't take much of a force to cause an injury. It can be a direct blow to the head. It can be an indirect blow to the body that causes a rapid acceleration of the brain within the skull. We mentioned earlier that there are some things that do potentially decrease the risk. You know, for example, having significant musculature could be one potential means by which you could reduce the risk of concussion. But it could be activities that are not involving contact whatsoever, or non-contact sports specifically, where it just takes an indirect movement, and that's enough to cause an injury. So, you know, Eric Lindros might have been a giant of an individual, but a concussion can occur to anybody.
Well, what do you read into the fact that both he and his brother had to retire because of concussions? Does that say anything to you scientifically?
Well, I'm not sure if his brother was also playing sports, so if they had that as an underlying link, then I think, you know, common things being common, being at play puts yourself at risk. But with that said, there could certainly be underlying genetic predispositions, and the literature about that is not as clear, but maybe we'll know about that more in the future.
Well, listen, this has been a phenomenal discussion here tonight. I'd love to wrap up with just 30 to 45 seconds from each of you summarizing what you think is important as we say goodbye here tonight, starting with you, Natalie.
Well, I think the message that I'm hoping is being received is that we're giving people the opportunity to raise awareness of the importance of not only concussion recognition, but also that there are now tools, resources, people that are available to help support returning to activities. So this may mean that we're giving athletes and parents and coaches a common language to discuss concussion, to make it safe to be able to discuss things on common terms, and that we're giving clearer protocols or approaches to returning to activities safely. So I'm hoping that people will reach out, whether it's through the resources that we share or to the people that they know, their coaches, the athletes, and start the discussions about concussion and management.
Dr. Maclaine, your final thoughts.
So I think that